Hello, my name is Mohammad Iskandari. Today I will show you how to examine the hip. First of all, we will check some steps to see is there any gait disturbance or walking difficulty. One of the things I like to do in hip pain is hop test. I like to stand up 1 feet, hop up and hop down. Thus it causes pain. If it causes pain, we'll think about potential stress fracture or an injury. From this point, we tell him to lay down. In inspection, we have to see lower abdomen and structure around hip and groin. Palpitation is also important. Palpitations around the major tendon attachment, so the ASIS, where the sartorius muscles attach at the anterior inferior iliac spine, where rectus femoris attaches. It also important in palpate pubic symphysis. In between ASIS and pubic symphysis, we can palpate hip joint. Next, I want to do hip joint movement. This movement test is not the specific test. This is very useful to identify the hip pathology. So, what you will do? First, flex the hip up and passively to see is there any pain. No pain. Extra flexion to see is there any pain. In 90 degree, we do internal rotation and we do sternal rotation to see is there any pain. Then I do quadrant test, flexion, internal rotation and adduction to see is there any pain or not. Then we will do another test, it's called favor test. Put the foot in contralateral knee and drop the hip, external rotation to see is there any stiffness or pain. This is how we examine the hip.